Good afternoon. Over the last 9 months, we have asked a lot from Hoosiers. Back in March, when the pandemic began to take hold in Indiana, and with all the growing cases and hospitalizations and deaths, we asked you to hunker down, and you did. And it made a difference. Then in early May, when the number of hospitalized COVID patients had decreased for 14 days, when we were convinced that we had the capacity for critical care beds and ventilators, when we began to build up our stockpile of PPE, and when we reached a point that we could test symptomatic persons and initiate contact tracing, we methodically began to lift restrictions accordingly. And as you'll recall, throughout the spring and summer, we continued our progress, gaining more confidence in our ability to take needed health precautions while various sectors of our economy started bouncing back, and we gradually and safely saw more and more businesses and camps and entertainment venues and restaurant options bring employees back as their market demand returned. Then in July, we paused and we added a requirement to wear face coverings when our case positivity rate again began to climb. When counties that previously had experienced many positive tests began to report more and more cases, and when hospitalizations increased because of COVID-19. We wanted to be in the position for our schools to safely reopen to in-person classes as much as possible. And we took actions to support that cause and that approach. We recovered nicely. Schools began to reopen, and that led us to move to Stage 5 on September 26th. The day we announced Stage 5, and please remember this, our positivity rate was 3.9%. We were testing an average of 15,000 Hoosiers a day, and our healthcare resources, including ICU beds and ventilators, were in a good place, a manageable place. But I also said at that time, very deliberately, that we could not let our guard down or change our good habits, because we know how and how fast COVID-19 spreads. Unfortunately, too many of us and around the country have let our guards down and either assumed we won't get it, or if we do, so be it, we'll get through it, without any more universal consideration to what these multiplying numbers have on others and our system of care for them. Stage 5 has been viewed by some as a reason to return to the days before we ever heard of the words COVID-19 or pandemic in a modern day sense. Rather than doing the things that we had been doing that allowed us to open our restaurants and shops and museums and attractions to full capacity while maintaining social distancing and wearing mask coverings, too many have said, we'll just ride it out, and if I get it, so be it. And that brings us to where we are today. We continue to increase our testing. We have solidified our supplies of PPE, and we have contact tracing programs that are fighting to reach as many Hoosiers who test positive as possible, and with as many who will work with us. But several of the other critical drivers that we've tracked since the outset of this pandemic that has been taking lives are reaching or have already reached critical points. Let me just name a few. The number of hospitalized COVID patients is at an all-time high, 2,544 to be exact, and hospital officials tell us that in some instances, their patient numbers may double over the next several weeks. You can look back at the last several weeks, and you can project out to the next several. And we're now averaging more than 210 new COVID patients a day in our hospitals. Our 7-day positivity rate stands at 10.3%, up a full 6% from the day we announced stage 5. Hospitals and other healthcare providers are experiencing staff shortages, and increasingly more staff themselves are having to call in sick. Because our frontline medical personnel, our nurses and assistants and doctors, they're exhausted and overwhelmed and need us all to do the things that we can on the outside that will slow the number of patients that need hospitalization and their treatment inside. That's where we individually all come in. We must do all we can to protect our hospital capacity so they can protect patients and care for them, not only for those who have the COVID, but for the cancer patient and the heart patient and the other Hoosier patients who need care in our urban, rural, suburban hospitals all across the state of Indiana. But their beds are filling up. They're being taken up. So, beginning this weekend, there will be no more stage 5. The Back on Track plan with stages was for sure helpful for us to help regain our footing and our economy. But now we must focus on how we'll get to the light at the end of this tunnel. And there is light at the end of this tunnel. We've seen widespread therapeutics like the one Lilly received emergency approval for earlier this week, made right here in Indiana. So proud. And we've seen reports of effective vaccines that will help protect us for the longer term. So we know what game changers they will be when they are widely available, but we got to get there. And our 4 color-coded maps will help us do just that. In September, we introduced these metrics maps that show the prevalence of the virus by county and provides guidance designed to help communities, local communities, make decisions about actions they could take to slow the spread of this virus. Some communities have done just that. They've taken various actions. And you've guessed it, others have not. Blue on the map means there is minimal community spread in a county. The colors progress or worsen to yellow, orange, and then finally red when there is very high positivity and community spread. You can see that in September, a large majority of counties were blue in the state of Indiana with low case counts and spread of the virus. This week, no county is blue. In fact, only 5 counties are yellow. Most are orange and 9 are now red. You remember last week I was talking about 3. Like many states across the country, we are in the midst of a second surge. So beginning November 15th, and for the next month, I'll sign an executive order that will implement pandemic requirements for all Hoosiers and targeted restrictions for counties that are in the orange and red status. We're taking these steps again to try to reduce the number of people who contract the virus, to quarantine those who are close contacts and isolate those who test positive, to protect our hospital capacity, and to give some measure of relief to our stressed and strained healthcare workforce and system. I know, I mentioned this before, I sound like a skipping record. But the best way we can help, it may be inconvenient, but it's also, turns out, happens to be the most inexpensive way to help as well. That means face coverings are still required to be worn by all Hoosiers. And do the right thing by not going to work or other locations when you're sick or symptomatic. All Hoosiers are required to maintain social distancing of at least 6 feet in public spaces, whether inside or outside, and especially when you are with others who are not members of your immediate household. All general requirements are according to the conditions we've already outlined in previous executive orders. Also, the Indiana Department of Homeland Security and the Alcohol and Tobacco Commission, together with local partners and citizen input, will continue to check businesses for occupancy, social distancing, face covering use, and other executive order components to assure compliance. We will now make $20 million available to local governments to support these type COVID efforts. Local governments, including cities and towns and counties, may request funds for such items as local event plan review and public awareness and education and compliance. We'll finalize this program and all the details in the next couple days. Businesses are required to place signage at their public and employee entrances notifying all that face coverings are required. Businesses should admit only those who wear face coverings, practice social distancing, and follow requirements when counties are orange and red. And remember, all customers in restaurants and bars and nightclubs are required to be seated when receiving service. 6 feet of distancing between non-household parties is required, including tables and bar seating. We have to do these things that work, that are proven to work, so our schools can remain open when safe to do so by following the recommendations of our State Department of Health. And on the other end of the age spectrum, Hoosiers 65 and older and those with other known high-risk medical conditions should remain vigilant about protecting their exposure to COVID. That means Hoosiers in contact with individuals 65 and older and those with known high-risk medical conditions should consider suspending in-person visits. As hard as that is, as this surge continues to crest. And obviously, it should go without being said, but please do not visit in person if you are symptomatic or have received a positive COVID test. And wear a face covering at all times around seniors and the more vulnerable. This will be, I know, extra difficult during the holiday season that's upon us for so many. Please keep your holiday gatherings in 2020 small. Keep them shorter maybe than normal. And wear face coverings. Consider limiting your gatherings to immediate household members only, or your identified small social pod. Maybe even gather outside, weather permitting. You've heard me say so many times that the virus is often spread when family members or friends let their guards down in social situations and take off their face coverings or don't socially distance and stay in close quarters inside for long periods of time. The holiday season is a time that reminds us to be thankful and to have hope. My hope is maybe this year it's our actions that can be the best gift we can give to one another. And lastly, let me just say, maybe repeat myself, get tested. There are more than 250 COVID test sites available throughout the entire state, many of which are operating free of charge by the state. Testing helps us know the local spread rate, trace it and isolate it, slow that spread. Dr. Box will go into more detail about new requirements for counties that have metrics that put them in orange and or red status. But the bottom line is social gatherings will be limited to 50 people in counties with orange metrics and 25 people for those in the red status. We will require that special seasonal or commercial indoor events seeking higher attendance submit those plans and receive approval from your local health officials. While high school basketball and other extracurricular sports and activities are among our most sacred events, it's our heritage, by gosh. But we will need to limit attendance at winter K through 12 activities in counties with orange and red metrics. If anything, this should provide everyone with the incentive to do your part, our part. Wear a mask, keep yourself socially distanced, don't attend events or visit others if you're sick, limit social gatherings, maintain self-hygiene. Let me turn it over to Dr. Box now, but first, just to repeat, in February and in March, the world didn't know a lot about how COVID-19 was transmitted. We're in a different time now. We all know now. And we know what we can do to protect ourselves and one another. As I mentioned, there is good news on the horizon. Lilly's antibody treatment for COVID received emergency FDA approval, and distribution is getting underway this week. There appears to be positive movement about the prospects for a COVID vaccine, and distribution plans are being put in place come that day. Like I said, we've asked a lot of you, and we're asking you to do even more through these next weeks and months as COVID is taking an even greater toll on us. With your help, we can and we will get through this. Dr. Box, the floor is yours to elaborate on the facts as we know them on the ground today.
Thank you, Governor. Good afternoon, Hoosiers. As you mentioned, we've seen a significant increase in the number of cases reported over the last few weeks. Today was the highest number of cases reported in a single day since the beginning of the pandemic. Our daily deaths are also on the rise, and once again, we're seeing this disproportionately impact our older Hoosiers. Our hospitals and healthcare workforce are being inundated. A number of our hospitals have gone on diversion recently, which means they are sending patients elsewhere. Many other hospitals around the state report delaying scheduled procedures or repurposing spaces like ambulance bays to hold patients until a bed becomes available. Hospitals should implement evidence-based criteria to reprioritize procedures and surgeries to ensure sufficient capacity to care for all patients. As the governor mentioned, these increases have significantly changed the look of our color-coded map. We've reached out to all 9 counties in red this week to discuss the cause of these increases. In some instances, increased outbreaks are related to congregate settings, and this is driving the change. But the majority of the increase is a result of community spread and pandemic fatigue. We're hearing that people are refusing to wear masks, that some employees are being told to come to work even when they're supposed to be on quarantine, and that parents won't test their children for fear of having to quarantine. I understand that this is hard. This entire year has been hard, but it's going to get even harder if we don't recommit to those very basic mitigation procedures that we've been discussing all year. Wearing a mask, socially distancing, staying home if you're sick and getting tested, and washing your hands. Based on information we're hearing on national calls, we expect the surge that we are currently experiencing to continue for a number of weeks. But actually, how long it continues depends on the actions that each of us takes today and in the coming days and weeks. That's why we are implementing the following requirements in counties that are in orange or red. If your county is in orange, social gatherings of any kind, indoors or outdoors, are limited to 50 people. Indoor special events, seasonal or commercial events for which more than 50 people are requested to attend must submit a plan to the local health department and receive approval before proceeding. Capacity in common areas and break rooms should be reduced, and users should always be socially distanced. Attendance at winter indoor K-12 extracurricular and co-curricular activities, including IHSAA sports, is limited to 25% capacity in consultation with local health departments. All non-competing and non-performing participants, support personnel, and attendees are required to wear their face mask and coverings at all time. All non-family groups must be socially distanced. IHSAA football games on Friday, November 20th may continue utilizing IHSAA guidelines that require local health departments and communities to determine the stadium capacity. The IHSAA will work with the Marion County Health Department on a limited spectator plan for state championship games at the Lucas Oil Stadium. Community recreational sports leagues and tournaments may continue with attendance limited only to participants, the required personnel, and a parent or guardian only. If your county is in red, social gatherings of any kind, indoors or outdoors, are limited to 25 people. Indoor special events, seasonal or commercial events, are not advised to be held, but a special seasonal or commercial event for which more than 25 people are requested to be in attendance must submit a plan to the local health department and receive approval before proceeding. College and professional sports events are included. Vulnerable populations should remain isolated. Social and holiday gathering participation is not advised. All business capacity must adhere to strict social distancing guidelines, and curbside pickup is preferred. Local officials may consider limiting hours for the operation of bars, nightclubs, and restaurants. Attendance at winter sports, indoor K-12 extracurricular and co-curricular activities, including IHSAA sports, is limited to participants, support personnel, and a parent or parents and guardian. All non-competing and non-performing participants, support personnel, and attendees are required to wear face coverings at all times. IHSAA football games on Friday, November the 20th may continue with attendance limited to the participants, support personnel, and parents or guardians. The IHSAA will work with the Marion County Health Department on a limited spectator plan for the state championship games. Community recreational sports leagues and tournaments may continue with participants, required personnel, and parent or guardians only. Senior center activities are suspended. Hospitals, long-term care, and other congregate settings may impose visitation limits. Common areas and break rooms should be closed. Enforcing these requirements requires resources, which is why the state is making $20 million in grants available to communities to support COVID mitigation efforts, including event plan review, training, compliance, and public awareness campaigns. I want to encourage county commissioners and other local leaders to expedite the process of applying for and receiving these funds so that you get the help you need quickly. Every one of these steps, masking, social distancing, washing your hands, and staying home if you're sick, needs to be a part of our daily lives as we wait for this vaccine to become more widely available. We continue to prepare for the possibility that limited vaccine will arrive in Indiana yet this month. The amount of vaccine we receive will be based strictly on population. There is absolutely no truth to the rumors that our allocation will be based on how high our case counts are. It's also important to understand that even though the vaccine effort has been named Operation Warp Speed, this vaccine is being developed through work that has been occurring for nearly a decade now. Scientists often begin work on vaccines but table that work if there's no demand for it, because developing a vaccine is an intensive and costly process. Researchers have been able to take the information that they already had to jumpstart this process. When we hear about accelerating the vaccine, what really has been accelerated is the number of people enrolled in these 3 phases of the vaccine trials and the manufacturing of doses occurring in concurrence with development of the vaccine. It often takes years to enroll thousands of people, but that process has moved very quickly as scientists work to provide a safe, effective vaccine. Our goal is to prevent people from getting COVID-19 in the first place, and Dr. Weaver will talk more about our vaccine planning in a moment. But if we do not get a vaccine, it was encouraging to see at least that the FDA on Monday granted Eli Lilly an emergency use authorization for its monoclonal antibody, which is a therapeutic designed to treat mild to moderate COVID-19 infections in adults and children. This is the first monoclonal antibody to receive an emergency use authorization for treatment of COVID-19. Monoclonal antibodies directly neutralize the virus that causes COVID and are intended to prevent the progression of disease. They are most likely to be effective when they're given in the first 10 days after symptoms begin. The medication is designed to treat patients who have tested positive for COVID, who are at high risk and are not hospitalized. Early trials show that of the individuals who received the monoclonal antibody, less than 2% of them became sick enough to require hospitalization versus more than 6% of the placebo group. The medication is given through a single intravenous infusion. Indiana's initial allocation for this week will be 2,700 doses. Only hospitals and affiliated locations may administer the drug. We have already been engaged with the Indiana Hospital Association to identify hospitals that are prepared to administer this infusion on an outpatient basis to patients who meet the criteria. Clark Memorial Hospital in Jeffersonville is located near the distribution center for this monoclonal antibody and had already identified 2 patients who met the criteria and were prepared to administer the infusion. The hospital treated the first 2 patients in the nation under the current EUA yesterday. The patients did well, they had no adverse reactions, and were released to home to be followed up daily. Dr. Weaver and her team will continue to work with hospitals across the state to determine which of them have patients appropriate for this medication and are ready to treat them. As we look at the promising movements on COVID vaccine and treatment, we can't lose sight of the immediate needs, not only in our hospitals, but in our long-term care facilities. As you know, we've engaged the Indiana National Guard to provide assistance in the 534 long-term care facilities across the state. By the end of this week, the Guard will have been deployed to approximately 1/2 of our long-term care facilities. We anticipate them being in the remaining facilities by the end of next week. I also want to encourage anyone who might be interested in joining the Healthcare Reserve workforce to reach out. Hospitals and long-term care facilities need your help. Since we first put out the call in the spring, more than 1,500 reservists have signed up, and many have been matched with long-term care facilities. A new survey is going out this week. As we deal with this current surge, your help is needed now more than ever. So please step forward, step up if you're able to ensure and help us provide adequate staffing in long-term care facilities and in our hospitals, and give those who have been on the front line for months a much-needed break. As the governor mentioned, this will be a difficult holiday season for many Hoosiers. It won't look like last year. It simply can't look like that this year. We will have specific holiday guidance to share next week. But for those of you making your plans now, please pay attention to the color-coded guidelines and what's going on in your community. Stay home if you can. If you can't, research the COVID situation in the destination you're going to before you leave. Know that there may be restrictions or requirements or quarantines when you arrive there. Consider the risk to yourself and others. And consider getting tested before you go and hunkering down when you get back. We don't want to see this surge get worse because we ignored all of our precautions over Thanksgiving. And now I'm happy to turn it over to Dr. Weaver for a more detailed vaccine update.
Thank you, Dr. Box. Our team at the State Department of Health has been actively preparing for the arrival of the first doses of COVID-19 vaccine in Indiana. The first vaccine we expect to receive is being made by Pfizer, and earlier this week, they reported that they may submit for an emergency use authorization as early as the third week of November. Pfizer is reporting that early analysis of its COVID vaccine trial indicates the vaccine was more than 90% effective in preventing disease among trial volunteers. Additionally, no serious safety concerns were observed. These results are extremely encouraging, and we will continue to evaluate the results when the emergency use authorization comes out for the Pfizer vaccine, as well as when we receive the Moderna vaccine, which could also come by the end of the year. Regardless of when the state receives the vaccine, we will not start vaccinating until we receive the EUA and the Advisory Committee on Immunization Practices review for each of these. Additionally, as we've mentioned, our External Vaccine Advisory Committee will also review all of this information for safety and efficacy, and to determine the appropriate populations to be vaccinated with each of these vaccines. The Pfizer vaccine in particular requires -60 to -80 degrees Celsius ultra-cold storage. This requires planning and coordination. We are actively working with hospitals and external partners to ensure that we have the right storage in place and a game plan to receive the initial doses, as outlined in the vaccine plan that we submitted to the CDC. As we shared last week, we were asked to identify 5 pilot hospitals that will receive the initial doses of vaccine. These sites will receive the vaccine after the EUA approval and will be stored there until we have the ACIP recommendation. Those sites are Community Hospital in Munster, Clark Memorial Hospital in Jeffersonville, Deaconess Hospital in Evansville, IU Methodist in Indianapolis, and Parkview Health in Fort Wayne. In addition, nearly 50 other hospitals across the state have raised their hands and are able to help administer these vaccines to their own frontline staff, to healthcare workers at other hospitals, and healthcare workers in the community. These hospitals will receive their shipments after both the EUA and ACIP recommendations are released. Indiana is also working with CVS and Walgreens to immunize long-term care staff and residents across the state. We know that a widely available vaccine is still months away, but we are confident that starting with protecting our frontline healthcare workers and those at highest risk will help reduce the burden of COVID on Hoosiers. In the meantime, the strain on our hospitals is real. The numbers that Dr. Bach shared are real, and the patients are sick. Last night, I worked my regular shift in the emergency department and treated more COVID patients than I have seen all year. Dr. Dan and Dr. Sullivan also worked in the ED yesterday, and they witnessed the same thing, and we are not alone. Healthcare workers need you to do your part, to help them do theirs. As the governor said, there is light at the end of this tunnel, and we can get there if we do this together. Thank you.